This is QL.
QL, this one is sometimes difficult for your patient to know what you would like to do. So if I say, would you please hike your hip, you'll see all sorts of interesting things, especially in a real population. Now in here, you guys know what the QL is supposed to do, and you know what a hip hike is supposed to do. But sometimes I say, can you hike this hip, and then they roll over. Really. So sometimes they're like, oh, that wasn't a hip hike at all. So sometimes you might have to explain that, give them words, show them with your body, so they know exactly what you're after. Okay? So for a 3, 4, or 5, let's do this side. You're just going to ask, can you hike this right hip up to your shoulder? So other words, good, relax, she did wonderfully. Other words might be, can you bring your hip closer to your shoulder? Whatever words you need to use. So she does that, go ahead and lift. And now what do I do for a 5? I give a good pull. What am I expecting if she's a 5?
Not to move.
She can hold maximal resistance, and now let go. She doesn't, let go, there you go. She doesn't break, yeah? She doesn't uncontract. So that's, if she can hold max resistance, that's a 5. Moderate resistance is a 4. And now for a 3, here's where we get different. For a 3, I'm expecting her to do the full range of motion. But I'm here to kind of be the assistant. Yeah? So I'm not helping her leg, I'm not forcing her leg to do something. I'm monitoring, does she do it? And I'm taking away the friction between the rubber sole of her shoe and the table. That's my job. Okay, Alice, can you please look back? And good. So she went the full range. I felt good about it. And I just go partial range. So I ask her to do it, and she doesn't go very far. And this is where your judgment has to come in, because like I was saying, I can't hold this. Well, I can't actually. And palpate this. But could I do this for 8 hours? No. I sure could. Ugh, right, terrible body mechanics. So for a 2 and a 1, this just has to be your best guess, your best judgment. So if you are the patient and you get a 1, do as best you can to give that person a trace. If you're a 2, go partial range. And we will understand if maybe there is some differences in interpretation of what your actor just did. Question?
Are you giving her the best range?
So it's really tough to go through passive range. It's a good question, because a 2 didn't go full range. How do I know what full range is if really all they did was a 2? And it's really hard for me to figure out a way to push her into a hip hike, so we just have to kind of make an exception to that rule.
I'm not going to let you push me off the tip. I'm not going to
Why
let
you got to be mean to me, Alice?
I'm not going to.
It's so mean.
It is.
So it's okay. We understand that.
I'm going to be a 2. You asked me to be a 2.
And certainly if she's a 2, let's say she is a 2, she doesn't go full range, and you're like, was that really the full thing? I'm not sure. And you give a little downward force, then she certainly wouldn't hold. Yeah, that might be a good example.
You can pull me further, so go ahead. You pull me further, and I'll go a little bit.
It's all right. We'll talk later. It's good. Don't overthink this one, everybody.